Moving on to our product update section, I know that most of you are users of our Output Management Suite. For this session, we're going to highlight the latest versions of those products. We're also going to be talking about electronic signature, which is functionality that many of you are interested in bringing to your hospital. To fill us in on what's new with the Output Management products, we're joined by our product manager, Yancey Stout, our VP of Products, Tom Holt, and a member of our Solution Architecture team, Tim Concannon. And to get us going here, I'm going to turn it over to Yancey.
Hello. It's great to speak with you all today. And really quick, I'm just going to mention where our vision is for product management right now. Our vision is, as Randy alluded to provide high-quality technology solutions that really enable healthcare organizations and employees to focus on their core mission, providing excellent patient care. Upcoming solutions will be focused primarily on clinical informatics, improving the effectiveness and efficiency of administrative processes and transition of care. Now I'm going to pass it over to Tom, and he will talk a little bit more about methodology.
All right, hi. Give me just a sec here to share my screen. I don't have the ball yet. We'll do this in just a second. So I wanted to talk a little bit about our methodology, and let me get that. Okay, great. So first off, I wanted to talk a little bit about the themes that we are addressing right now within the platform. So these themes are throughout all the work that we do. All the features that we put into the software fall into these major groups. Scalability, because we wanted to make it easier for to build solutions for large numbers of users and large amounts of data. Usability, we've been working hard to create a user interface that not only solves user problems, but does it in a way that requires less training on the front end and is more efficient of the user's time once it's been deployed. Security, we are constantly using best practices to ensure their software is as secure as possible. That's a very important thing we want to always keep in mind. Mobility, we recognize that, that mobile devices, both handheld and tablets, are becoming increasingly important, and we want to make sure that you have the tools to incorporate those into your organizations. And then interoperability, as Randy mentioned, at FormFast we've been at the forefront of interoperability, integrating with all major systems, and we are doubling down on that with the use of some of the emerging standards. As Randy mentioned, Smart on Fire, we are looking to make it easier, even easier to integrate with existing systems and even ones that are still being designed. So I want to talk a little bit about our process. Hopefully some of you recognize this reference. This is not what our process is. We are an agile and very, well, let me just say, I was going to talk a lot here about the changes we made to the development and release process here, things that we've been doing like instituting Agile Scrum and then moving to Lean Kanban, about creating a regular patch schedule, increasing our use of automated testing, increasing the size and experience level of our development team, training, refactoring, working like crazy, pizza and Jolt Cola on tap. But the real thing that you want to hear is that we're delivering more value and more features, more scalability, usability, security, mobility, interoperability with every release. And since we've started a regular patching schedule, you don't even have to wait for the next release to get bug fixes and minor improvements. So what's new? So in the last year, since we had this user group meeting, we've put out 3 releases, and I'm going to kind of go through those one by one and just highlight some of the major things that that have come out in those releases. So last year around this time, we released version 6.1 of web form imprint, fast print, and e-signature. Also fast flow, but we'll be talking about that tomorrow. And this included a new user interface for web form imprint, one that's based on the latest HTML standard, HTML5, that really helped to make that user interface not only look better, but be more functional, a little bit easier to use. We added automated database cleanup in there. This is something that had been a custom thing for each implementation, and we decided that that made enough sense. We did that pretty much everywhere we went, so we went ahead and pulled that into the application itself. We included, as part of both our e-signature and in our e-signature application and part of our mobile theme, one of the features that already existed in e-signature we added to our mobile e-signature platform, which is automated date and timestamp. Moving on, release 6.2, which came out first part of this year, we added the ability to install local print client and capture client, also known as the e-signature client. We gave manual installers to those, which helped us with both security and our interoperability with people with virtualized environments. We added printing to our mobile e-signature client, and we increased the security of our databases. And then going on to version 6.3, which just came out a month or two ago, here's where things got really exciting. We added scalability, better scalability to our offerings. So we went 64-bit, which allows the server to be scaled up. You can now use a much more powerful server to serve the software. And then we also did some testing around and put out some guidelines for using web farms, so that if you would prefer, you can scale out and just create multiple web servers that then serve the exact same data out to your customers or out to your users, and allow them to not have to know a different URL or a different login or anything, but gives you not only scalability but fault tolerance as well. And then we included better memory management in there. We looked around and we said, okay, how can we make this better on just the same hardware? So we cleaned up some things in the application to make the memory usage much more efficient. So I think what I'd like to do now is hand this off to Tim Concannon, who is going to show us e-signature.
Right. All right, so hi everyone. Like you've already been told, my name is Tim Concannon. I'm one of the solution architects at FormFast. And today we're just going to quickly go through our electronic signature process for your facility. I know a bunch of you already have this, so I won't go into every single little piece of detail on the screen, but we'll make sure that we do cover all the fun and exciting new pieces. The first thing I should mention is that I'm going to start right on my FormFast capture client. This is the screen that you'll launch to based on your EHR. So if you're with Meditech or Epic, it doesn't matter what EHR you have, we can automatically launch this capture client right from the registration process. One of the nice pieces of that is a lot of the times the registration clerks themselves don't even realize that you have FormFast. Because we integrate so well with the EHRs, a lot of hospitals think that we're just part of that EHR that you're already using. Kind of a small thing, but that does lead to a lot more satisfaction when we're going through the training process. I've seen a lot of registration clerks just think that, all right, I'm learning a new piece of, say, Meditech. It's an easier sell than trying to tell somebody that they have to learn a whole new piece of software. But with that being said, we'll just start talking about the screen a little bit first before we actually process this document. You'll notice over on the left, I have my icons here. And my icons are really just going to give me a quick little show of how many forms I have. So one thing I should talk about is how our forms are actually generated. So based off the information that you enter into the EHR, again, no matter what EHR you use, we can use this. We can actually base the information that's entered to determine what form should be brought into this capture client. So for example, if you have pediatric patients, we'll make sure that based off the age, we can have specific forms, or even insurance for Medicare or Medicaid patients as well. So again, that's going to save a lot of time for your end users to make sure that they are no longer trying to hunt down all the pieces of paper, all the right pieces of registration paperwork that needs to be signed. Along with those icons over on the left, we have little color-coded dots below each page. The dots are going to tell me what I can do or what's missing on that particular page. So you can see I have my blue dot for my first page that's going to tell me that I have blank fields, but nothing is required. There's also a green dot. A green dot would just let me know that there's nothing left to be filled out on that specific page. And then you can also see that I have a red dot on my second page, which is going to be a required field. We'll talk about the required fields in a little bit, but just so that you see how the dots display here. Another nice feature of our capture client, though, is that I can also have a secondary monitor. So I'm going to just pull up my secondary monitor screen. Here you can see that I can display the same exact form to my patient. A lot of our hospitals have a secondary monitor facing the patient. The purpose of that is really to make sure that the patient can follow along with the form and see exactly where we are within the registration process. It's going to really reduce the amount of questions that you're asked, making that process a lot more seamless, getting that patient through registration faster, back to seeing the nurse and the doctor, which is what all of our patients really want anyways. So going back over to the main screen, this is again the screen that the registration clerk would see. You can see that I'm pulling in certain information from the EHR to my form as well. For example, I'm pulling in the patient's name here at the top. And also if I scroll down a little bit into my footer, you can see that I'm bringing in all my ADT information into this footer as well. So our footers and headers can be standardized so that we can bring in the same data across all of your forms. That's going to be something that your form builders are going to like a lot. It's going to save a lot of time. I know that the name of a hospital or even just the emblem of the hospital can change pretty often for a lot of you. So if you're able to have one standard header or footer and you're just changing the emblem once instead of on all of your forms, I know some hospitals have hundreds upon hundreds of forms, so it is a big time saver for you on that front. Another nice feature is that we can bring in barcodes. So for example, if we want to change our account number to a barcode as opposed to just listing it out like I have over on the right, you can see that we can transfer those into a barcode and have those print out or display in the capture client as a barcode here as well. So at this point, I'm going to actually start processing my form on the capture client. Another big thing that a lot of our hospitals like is that even though we're talking about electronic signature, we're not restricted to just electronic signature. So for example, I can click on my type ahead box and I can just fill in the name here as well if I need to do so. And if I scroll further down, you can see that I have checkboxes as we go through the process as well. So as a registration clerk, I can ask the patient these questions and quickly check them off as we're processing the paperwork together. We'll skip over to my second page here. And on my second page, this is actually when I'm going to get into some of the signatures themselves. Before we do, though, I do want to just quickly point out that along with patient information, you'll notice that over on the left, we're bringing in the date and time. Such a small thing to have the date and time come into this form. However, that's probably a question that's asked of the registration clerk every single time a patient crosses their desk is what time, what's the date when we're trying to fill out that information. Again, you'll notice that I have my check boxes. I'm going to just check one off real quick. And at this point, we're actually going to talk about signing the document. So first, I'm going to just click here to sign. So I'll click my icon right next to my blue signature box. This is actually how I can tell whether or not the box needs to be, this particular field needs to be signed. Check off my box, and that's actually going to turn on my signature device. FormFast works with a lot of different signature devices. I'm using a Topaz device. Based on whatever device you use, you will have specific functionality. For example, my device can actually bring in the name of the field that I'm signing. So as the patient, I can see that the field that I need to sign is a responsible party signature. So I know exactly what I'm signing. Again, trying to reduce those questions for our patients and registration clerks, making it faster, making it easier for the patient to get through the registration process. The other nice feature is when I'm signing, you'll notice that as I'm actually writing on the Topaz device, it's going to appear on the screen at the same time. So as the registration clerk and as the patient, I know exactly where I'm signing, what I'm signing, and what my signature looks like. Along with that, as soon as I hit OK on the Topaz device, you'll see that I'm actually now locking down this page. So I no longer have my checkboxes here. Instead, I just have what's already been checked off. But we can also bring in the date and time on that actual signature as well. So it's just another way to display that date and time, again, making sure that you have all the necessary functionalities that you need to be able to build the forms effectively and efficiently for your end users as well as your patients. The other thing I should mention about our Topaz device is that, it's the same type of signature process that you're used to seeing every day when you're going to get lunch and pay with a credit card, the grocery store, wherever you are. I'm sure that you've used them 100 times. Now, when we're talking about locking down the form because I have this signature, I do just want to point out that I'm only locking down the second page. So if I go back up to my first page, you can see that I can still process this page up here as well. That's going to be a pretty important thing for your registration processes that may have 6 or 7 pages and you have to capture signatures throughout the process. You don't want to have to process them all at the end. So therefore, as you go through each individual page, you can actually sign them here. Another nice feature is that if I need my registration clerk to sign off anything, I can actually just right-click on my icon that would actually turn on my Topaz device. And if I right-click instead of left-click, I'm going to have this self-sign option. And the self-sign option is going to allow me to just imprint an electronic signature here. It's not going to be a wet signature like we have above. It's just going to have a timestamp. It's going to say electronically signed by in the registration clerk. So that information will display in that box as well. One other thing that a lot of times we get asked about is what happens if a mistake is made once we have a signature. So you can see that this page is locked down, and once we have a signature, that's going to happen. But if I go back over to the left, you can see again on my icons of all the different pages, by right-clicking on that, I have the ability to clear the form. If I say yes, it's going to remove all the data from this particular page, and again, I can change my checkboxes here if I need to. Again, that's only going to change that one specific page. It's only going to have an effect on that one page. So if I am on page 7 out of 8 and I make a mistake, I don't have to go through and process them all over again. It's going to happen just for that one specific page that has that error or something that I need to go back and change. So as you can see, actually processing the capture client, actually processing the forms through it are going to be pretty simple. The training process for your end users is pretty straightforward. All we're really going to have to do is make sure that they understand where we're checking off and where we're going to need those signatures. The biggest piece and the biggest time saver and probably money saver down the line is going to be these required boxes as well. We've heard a lot of horror stories of hospitals missing one specific signature and not being able to get reimbursement for an entire surgery. That won't happen once we have these required fields because we make sure that everything is going to be signed properly and all the required data is entered. We're not restricted to just requirements on signatures. However, that's just kind of the most popular field to make required. Once I have all my data filled out, all I would do is I would click Done. You can see I have my Done button at the top. And at that point, we would file the forms through your scanning and archiving modules and send them over to the EHR. So if you, excuse me, once they're scanned in electronically, they'll probably go to the same exact spot that you have your forms going today once they're manually scanned in. I mean, I say probably just because you do have the ability to change it if you want to, but most of the times we see it kept exactly the same. The other piece that I want to show you today, though, is going to actually be our e-sign on a tablet. So I'm going to just actually add my tablet to my screen here. It's a little bit bigger earlier. Okay. So you can see that I have my tablet displaying. I'm actually using an Android tablet. We're not restricted in any way or any tablets themselves. Most commonly, you probably see iPads and Windows services. Again, it's completely up to your hospital what you want to use, but when you do, we're going to be able to bring in web form imprint. We talked about that a little bit earlier, and you can see that I can check off my patient, check off consent. Clicking sign at the top is going to launch that same capture client that we already talked about. Oh, I might have a timeout. Sorry, it looks like I just timed out. Let me just check off that information again for you real quick. So one thing that I will just point out here is the forms are going to display exactly the same. We're not going to have much of a change. I have the ability to have my barcodes, all of that administrative data that can be pulled forward from your registration process. The real main difference is when I'm signing, once I click in the signature box, really what we need to point out is that the box is going to become larger. Obviously, we're going to be signing on the tablet on itself. So here I can just fill in the information in a larger box as opposed to on the Topaz device. Having this larger box saves me a lot of errors because I'm not necessarily all that good with signing with my fingers, but obviously you can use different styluses as well. Okay, so again, all the functionality is exactly the same on the tablet device as it is in the desktop version as well. Before I give control back to anyone else, I'm going to make you guys listen to me and for a little bit longer and just talk about our web form imprint for a minute. This is our other launching point for electronic signature. It's the launching point I just used on the tablet. Really, the main difference here is that I'm picking my patient in my form as opposed to having the registration process determine what forms I'm going to need. Pretty straightforward process though. All you have to do is check off your patients here as well as your forms. The forms and the patients are both access driven. Obviously that's important for the forms to make sure we're not cluttering the screen. And the patients are going to be access driven as well to make sure that we're compliant with all your HIPAA regulations as well. I should also point out that all of these columns are clickable and sortable. So if I want to sort by, say, attending physician's last name, I can do that and sort all of my patients like that as well. Once I have my patient in my form checked off, though, all I would do is click sign. And clicking sign is actually going to launch that same capture client that we already talked about. So again, going back to the training process, you're training all of your users to use one capture client as opposed to two different processes depending on where we're launching from. So again, it's a good time saver on that front, and you're probably going to get a lot less pushback from your end users when it's conveyed like that as well. One other thing to talk about in our web form imprint screen is how each of these desktops are completely customizable. So you could have different forms or a different layout in general for, say, your ED nurses or ED unit secretaries as opposed to your inpatient nurses. So again, depending on what information each particular user needs, can be displayed here in an easy way so that they can locate the patients that they need as well. One column that a lot of our hospitals do really like is this incomplete forms column over on the left. The nice piece about that is that I can ensure that I have all the right information filled out before I'm actually discharging my patient. So the biggest scenario that we hear about our incomplete forms being used is going back to the ED. And when a patient comes in unconscious or cannot fill out the form, we have those forms triggered through the registration process. When we're going through the discharge or depart process, I come here and I can see that I have incomplete forms. I check off my patient, I click sign, and we can get to the signatures once they're actually, once the patient is actually able to sign the form themselves. So that is my run through on electronic signature. Aaron, do you want control back to?
Thanks, Tim. I'm going to pass it over to Yancey to talk a little bit more about e-signature and more specifically consents.
Yes. All right. Let me just.
Looks like WebEx is connecting there.
There, yeah.
Just a reminder as that's getting loaded up to go ahead and submit questions that you have on any of these products, FastPrint, WebForm Imprint, eSignature, Form Central if you're using Meditech Magic, and then we'll direct those to our presenters at the end of this section.
Should be. Stand by just a minute. Following Tim's presentation, which is an excellent presentation on e-signature, I was just going to follow up briefly on our consent solution and what we're doing with that. Well, Aaron?
Looks like it's
giving me an issue.
You might try unsharing and sharing again so it connects properly.
Right. Actually, what we can do is I can just talk about it for a minute while it loads up. Basically, we really want to provide a great consent solution for your organization, covering all types of consent, from surgical and procedural to patient transfer and blood transfusion. All of your consent needs, make them electronic for three main goals, and that is ensure compliance, make sure that those forms immediately get to the EHR system and they don't get lost along the way, and they're there in a timely fashion. So there's no delay in the OR or when they're trying to access the forms, make sure they're there, or to reference back to them and they haven't made it there. So this ensures that they're there right away with an electronic consent solution, as well as improving the patient and the clinician's experience. The patient, of course, we're all trying to improve that experience, make it more streamlined, sophisticated, technology advanced, and so certainly electronic consent fits that bill and smooths out that process for them. It also can provide a better process, more educational in nature and more conversational in some cases. For the clinician, we're trying to minimize the time that they have to do anything other than patient care. So in this case, if they don't have to print something, they don't have to then go put it somewhere, make sure that it's scanned. They don't have to worry about any of that. It's all on the device. It's handled, and it's already electronically sent to the EHR. So we're trying to actually improve both of the experience of the patient and the clinician in that case. And then we're also trying to protect the patient. As I mentioned, more of an educational process, up-to-date forms, making sure that the form that's used is always the most current version and approved is very crucial for the patient as well as the organization. So that's something that is very important to always remember as well, and I know it's on all of your minds as far as protecting the patient and patient safety. So those are the main things that we want to keep in mind and the main goals of electronic consent. You know, obviously, as Tim pointed out, the mobile capability makes things a lot easier and convenient for, again, both the patient and the clinician. And you're going to reduce paper as well as printing costs, which saving money is always a good thing. Still thinking. All right, so moving on from consent, I was just going to speak with you all for a brief few minutes about our roadmap concerning solutions, kind of where we're going, what we're focusing on. And I mentioned the vision earlier, so to back that up, some of the upcoming solutions that we're looking at, very exciting and some great stuff. So the first one is FormFast for human resources. And we're going to talk tomorrow more about FastFlow specifically, and you're going to get a much more in-depth overview of that software and what we're doing in that area. But just to give you a preview, for human resources, we want to provide not only the ability to make your human resources processes faster, but we want to make them better and more effective. Human resources has a really big challenge right now in healthcare to retain, hire, onboard all of these employees that are focused on patient care and excellence in a highly competitive market. And so in order to do that, we at FormFast would like to provide workflow software that makes that easier to accomplish in the ways of an onboarding process. The ability to execute that onboarding process with accountability and visibility into the entire process. You know, everybody knows who's supposed to do what. HR can run the process without having to manage 15 different things, but looking at one dashboard. So that can be very helpful to HR, plus improving the process and onboarding employees in the most effective ways with socialization, strategic as well as more transactional tasks in that onboarding process. Also focusing on the process of recognition. May not be automated at your facility. You may be looking at that. FormFast can provide a platform for you to provide that to your employees, where employees can recognize other employees and supervisors can recognize their employees. Supervisors can also coach their employees. And you have that conversation constantly going. Employees are engaged. They're feeling appreciated and recognized for the great work that they do. And we even have, you can do senior leadership. And the great part about all of this is very customizable to how you would like the process to run. So those are a few things in the HR arena that we're focusing on, and you'll see more and more about that in the next couple months. In the consent arena, I just spoke about that. There's a lot of exciting things going on there, and we will be focusing on that in the rest of 2015 and beyond. So really wanting to get organizations using electronic consent and seeing that positive outcome for the patient and their employees. FormFast for finance and materials management, as well as risk and quality. Again, using our workflow software to improve and make more efficient your processes that are crucial to the operation of the hospital. Everything is supporting the outcomes and, working towards improving, making the hospital more efficient and saving money. So we want to provide some of those solutions for you. Okay, so that's where we are with the roadmap for solutions. And now I'm going to hand it back over to Tom.
Hi.
Which is going to talk about roadmap for products.
Excellent. Okay. So let me see if I can do this. Great. All right. So, whoa, there we go. So I wanted to give you a little bit of a peek into some of the things that we're working on for the future. So one of the things that we wanted to do is to make the product easier to administrate and to configure. We've done a lot of work on the end users and helping their experience to be better, but we also realized that the administrators, we just wanted to make sure that their experience was just as easy and positive as the experience that we created for the end users. So I'm going to show you a demo of some of the things that we're working on for the next upcoming version in just a minute. But let me talk about a couple of these other things first. We also recognize we have Active Directory integration, but we wanted to ease that and make that more functional, especially for our clients who have very large installations. So as part of our desire to be more scalable, we are improving the way that that currently works. Once again, I can't say enough about this. We're very excited about FHIR and integration and using that as part of our integration. I think a while back, no one was quite sure whether FHIR was really going to take off or not, but we are definitely seeing that within the marketplace, within the industry, FHIR is taking hold. And so we are jumping right on the edge of that wave, and we are going to be part of that movement. We are putting in even more usability improvements. So I said we were doing it for the administration and people configuring it. We're going to be doing more usability improvements for the end users as well. And then finally, one of the things that we are aiming towards, and what you'll see with the administration configuration part of this, is a piece of this. We are moving towards unification. And what that means is that right now we've got a lot of functionality in various parts of our suite, and we want to make it much easier to use functionality from one part of the suite in another part of the suite. So as part of doing that, we're going to start merging the code base. So you can already see that the look and feel of all the applications is very, very similar. So that if you're in a FormFast application, you know you're in a FormFast application. We want the functionality that's available in one place to be seamlessly available somewhere else. So those are some of the things that we are looking towards doing in the future. And I wanted to give just a real quick demo of what I talked about with respect to the administration and configuration. So I'm going to bring up a browser window here, and I hope you'll notice that this is actually Chrome. Chrome is one of our supported browsers, especially for the later versions for 6.0 and beyond with FastFlow, 6.1 and beyond with web form imprint. So you don't have to just use IE. You have another choice. And that's because we're standards-based now. We're using HTML5, which works similarly on all modern browsers. So that's just my plug for modern browsers. So let's take a look at the administration page on this. You'll notice that I've got both of these open. So let's go and take a look at the administration page within web form imprint. since that's kind of our focus today, you'll notice that this looks completely different from the way it used to look. If you remember back, even just the styling, but even the functionality of how this page works is different. This page actually shows a card for everything that you could do within either FastFlow or Web Form Imprint. If you only had one or the other installed, there's a lot of these cards that are only available for one group of applications. The ones that aren't appropriate for you would not display. The great thing about this page, though, and this is something that, it's some feedback we got and some research we did on how things are configured within our software, is it's a little bit hard to find that thing that you're looking for from time to time. So let's say that I wanted to affect a user. I wanted to change a username. I can just type up here, and then I can find all the things that have to do with users. So this whole page here is now dynamic, and it sorts in real time to show me the things that I'm interested in. If I go to users, you'll see that this has been restyled. It's easy to find the thing I'm looking for. Once again, the searching is very quick. If I can type, and it sorts down just while you're typing. So that's the kind of thing that we're putting in. We've changed where we've standardized a lot of things that used to be a little bit different on pages, so that you'd have to be familiar with the page. We've given ourselves given you breadcrumbs to get back to where you're going, so that you can navigate back and forth without losing track or without having to reload and go back in. The other thing that I want to show you, and this is exciting because the developers just finished this code today, is that this exact thing that you're seeing here is identically coded in both FastFlow and Web Form Imprint. So you can see here, this is the same set of functionality here and here. It's presented a little bit differently because of the menuing structure of FastFlow versus Web Form Imprint, but it all works the same, so that if you're familiar with one application, you can use the other application the same way. So that's just an example of the kinds of things that we are putting in to modernize our applications, to make them cutting edge, and to make them easy, not just for end users, but for administrators and people configuring the software as well. So having said that, I think we are ready for questions.
That's right. We're going to open for questions now. I'm going to take over the screen as a presenter. And as we're waiting for questions to come in, just to echo what Yancey said, there's a lot of solutions that we can provide with our technology. You're going to hear more about that tomorrow as part of our FastFlow discussion. But in the meantime, we want you to share your challenges and share your thoughts. Once again, feel free to reach out at formfast.com/contact to fill us in on the processes that are a challenge, that are top of mind, that you'd like to see more automated. Okay, a few questions already. Let's see here. I'm going to start with a question for Tim, and this is regarding e-signature. Person asked, does the printed name piece get pulled into the appropriate lines as well? And I think that has to do with the self-sign piece, if I'm not mistaken. If you'd like to, if I'm off point there, then feel free to submit a follow-up question. But I'll direct that one to Tim.
Sure. So if you want to have the names pre-printed or pre-populated based off of the information entered into the EHR, you can bring those into anywhere on the forms. I think you're referring to my second page where I had the printed name and then the signature name or the signature field. So if you have the patient signing, you could automatically bring that information in, yes.
Excellent. Another question, can you use mobile devices at registration?
Absolutely. Okay. I wasn't sure who that was for, but yeah, absolutely.
That could be for Tim or for Tom.
We have customers currently doing that, yes, quite successfully.
And a somewhat related question, can eSignature print a copy of the signed form at admissions? I'll direct that one to Tim.
Sure. Could you hear me on the last one, Aaron, just to make sure?
I sure could, yep.
Okay, good. I think I missed you for a second. So to preprint, we don't necessarily preprint from FormFast. However, based off of the EHR, again, I'm sure that we could work with them to make sure that we can preprint that form to have it come out automatically as well. The reason that we don't is really because our product is hopefully to move you away from printing out the forms and having them just manually, have them electronically scanned in.
Okay, a couple questions coming in about checkboxes and other types of annotation. Doug asks, or Douglas rather, I see true checkboxes on the screen in eSignature. Can a checkbox be used on the Topaz signature pad, the color 5.7?
Having checkboxes coming into Topaz devices is going to depend on what Topaz device you go with. Some of them are more complex. My specific one, I do not have the ability to do checkboxes, but depending on what signature devices you buy or purchase, it will determine what type of functionality you have.
As a follow-up, Tim, maybe you can give an overview of some of the other types of input that we have as part of eSignature.
Oh, okay. So with the electronic signature, we have the ability to obviously sign for the electronic signature. We have the free text fields. We have the check boxes, and then all the pre-populated information from the information that's been entered into the EHR.
Okay. Let's see here. Question from Jim about whether this is going to be recorded. It is. We're recording the content as we speak, and we'll also share the presentations. So we'll send that out after the event. A question about Form Imprint. A user is using Form Imprint, and I wondered about how they can upgrade to Web Form Imprint, which you showed, Tim. I'll let you speak to that.
Sure. If you're using Form Imprint, it is probably your best bet to contact your sales rep. If you don't know who your sales rep is, you can contact either myself or Aaron and Philip. I'm sure that we can find out exactly who the sales rep is, and we can make sure that we set up a meeting to determine what's needed to get you on Web Form Imprint from Form Imprint.
And as before, you can always reach out to us at formfast.com/contact. Philip just provided a link in the chat, so if you want to click on that link and then drop us a note, then we'll respond to you and let you know who your RSM is. Question about Internet Explorer 11. Any issue with that browser? I'll direct that one to Tom.
Okay, absolutely not. In fact, as some of you may know, we recommend IE 10 or higher. And in fact, starting in January of next year, Microsoft is discontinuing support for a lot of the legacy browsers. So their recommendation is IE 11 or going forward, and that is our recommendation as well. If you're going to use a Microsoft browser, IE 11 is the one to use. They have a web page that says how to support legacy apps that require earlier versions, but we are fully compatible with IE 11 for sure.
Next question I'll direct to Tom. What does FIRE stand for?
FIRE stands for, I'm going to get this almost right. It is Fast Healthcare Interoperability Resources. I think I got that right. But FHIR is a standard that allows discrete data to be transferred between different healthcare systems using XML and JSON. So it is standards based on its transport method, using common standards that are being used throughout the computer industry right now, but tailored with its content for healthcare, but then standardized within healthcare. It's really a very interesting and very exciting standard.
And I'll go ahead and direct the next one to you too, Tom. Is Windows 10 supported?
We have not tested on Windows 10 yet. We expect with the next version that we will, and then we will fully support it as well. But Windows 10 actually came out after our last release.
Okay, the next one's for Tim. I know that you showed the system will recognize missing forms per whatever rules are in there, but can you manually flag documents needed for the patient? I'm thinking about check processes done by registration.
Can you, I'm sorry, Aaron, can you, you skipped again on me a little bit. Can you just repeat that? I'm trying to find it in the list.
That one's down in the Q&A section from Brian. I think you have visibility into that. And the nature of the question is around manually flagging documents that are needed for the patient.
Oh, so I mean, ideally, we won't be. You don't have to manually flag. It will automatically flag the necessary documents. So based off of that information that you enter into your registration process, we will flag, so FormFast will flag what forms are needed, and then it removes that manual process for you altogether. And then if you're talking about the chart check later on, after the registration process, that's done by the nurse, we send all the information into your EHR. So if you're looking for the EHR, if you're looking in the EHR to make sure that all the documents are there, it would have to be a check on the EHR side instead of the FormFast side.
Great. Another question about FastFlow. You mentioned FormFast, FastFlow for human resources, finance, materials management, risk, and quality. Is this going to be reviewed tomorrow? Unfortunately, since there's so much that we can do and we have a limited amount of time, we won't be able to cover all those areas in detail. We are going to be talking a little bit about HR processes. In the meantime, I recommend that you visit our website. We have sections for each of those different areas that spell out some of the processes that we've automated in hospitals. So definitely take a look at that. And then if you have particular processes or areas that you want to learn more about, send us a message, and I can see how much we can squeeze in that speaks directly to what you're interested in tomorrow. Another question for Tim. Is there a way of rearranging columns in web form in print on an individual basis and saving them for the next time they sign on, or creating a different look for different people?
You can definitely create a different look for different people. The majority of the time that's done in the access groups themselves. So you may have to play around with your access groups a little bit. As a user myself, I can't necessarily move my columns from left to right individually. Actually, you know what? It looks like that's a new feature that I do have the ability to drag from left to right now in web form imprint. So if I wanted to move, for example, the first name of the patient off the screen entirely, I could do that here. However, I would have to refresh that. So as an end user, you're probably better off reaching out to your IS staff to have them try and get the web form imprint screen to look exactly how your end users want. A
couple questions about devices. And I assume that this question is about devices. I'll start with this. Do you have a preferred vendor for e-cig capture? And I'll direct that to Tom.
So a lot of our customers are using Topaz devices. Obviously, if you are on mobile, you're going to want to use a mobile device, and iPads are very popular for that. Also, we've had good luck with Surface Pros as far as from the Windows side of the tablet world. But you know, we integrate with a lot of different things. I think those are probably the most popular, though.
A question about Form Designer. Wondering if we'll speak about that. We will. We have some exciting news about Form Designer that we're going to share tomorrow afternoon, so definitely tune in for that. Looking to see what other questions we haven't answered yet. And it looks like, I believe we've addressed all the questions that have come into the chat and the Q&A. Let me just do a final pass to make sure I've addressed all of those. One more question to address. Alice, it says they're currently on a 5.2. I need to upgrade to the latest version. Can we go directly to the latest version, or do we have to install each version? And that'll be a question for Tom.
And the answer there is that you can go to the latest version directly from 5.2. I'm assuming that you mean 6.3. However, if you still have IE8 browsers running around, and so you need to stay on the the version 5 branch of the code, you can go directly to 5.4.
All right, I think that's it for all the questions. If you think of additional questions that you'd like to have answered, once again, reach out to us, formfast.com/contact, and we'll make sure that we reach out to you to answer those questions.